Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Could we take up constipation?
Yes. Constipation is very common complaint. Now it's very difficult to define constipation. We have seen people who pass every day 3 to 4 stools, but they say they are constipated. Then there are people who pass stools once in 2 days, once in 3 days, and even they never say that I'm constipated. So clinically, the definition of constipation is that if the person is, the function of expulsion of fecal matter through bowel movement is the function of rectum or even large intestine, we can say. It's a well organized network. So fecal matter is well formed in our large intestines. Once the things are digested and absorbed in small intestines, in large intestines mainly the fecal matter is formed. So the adequate quantity of fluid, everything is absorbed, and formation of stools takes place in the large intestine. And as it approaches the rectum, and if there is enough quota of fecal matter collected, we get the sensation to clear it, and if the things are conducive, person can excrete it. So this is the physiology of our rectum. Now the people who always feel that they have not excreted the complete quota of fecal matter in the rectum or in large intestine, they always have that discomfort feeling, and that we can call it constipation clinically. But if we want to ascertain through our laboratory tests, what we do is we give charcoal, an inert substance. We give charcoal and just see in how many hours it is excreted through stools. And if it is excreted within 72 hours, we say the person is not constipated. And if the charcoal is not excreted completely within 72 hours, then we label that person as constipated. This is our definition. But there are people who pass stools every day 2 times, 3 times, 4 times, and still they feel they have not cleared their bowels and they feel constipated. One thing we advise is that you should not strain for stools, because you create confusion in our system. It's very clear that whenever there is enough load of fecal matter there, we get that urging, the pressure, and once, of course, it gives you enough buffer time also. Doesn't matter, once you get pressure, you can attend it once in, say, within 1 hour, half an hour, immediately, or even later. And even if time doesn't permit or the situation doesn't permit, the fecal matter can again go in reverse order to the rectum, to the colon, and get lodged there waiting for proper time to excrete. So there is a lot of buffer arrangement in our system. But people are paranoid about it and they go on dwelling upon it, and if someone has fixed idea that one should pass stools and then go to have yogasana and then go to office or workplace, and if they don't get enough pressure, then they try to cultivate, go, strain, sit there, wait there, and then that creates really confusion. So best thing is that whenever there is a pressure, you attend it, and it can be in few minutes or even in half an hour, and as much as if it is evacuated, okay with it, be okay with it. You shouldn't go on straining and trying to clear it by force, because when you strain, the intra-abdominal pressure increases, and that really what we can call affects the whole body. Sometimes we have seen that even the blood pressure gets raised when person strains for stools. And we have seen cases where there has been aneurysm getting ruptured because of this. So straining for stools or bowel movement we never advise. But once initially, suppose there is disturbance in digestion, there is some irritability in the rectum or colon, you may get once or twice or thrice more frequent stools. But once the things are cleared, again it will get regularized, and body somehow cultivates that once you get up in the morning, within half an hour or so, you will get the sensation to clear the bowels and you won't have issue even up to the next day. So if this rhythm is followed, if this rhythm is cultivated for whole life, one will not be even aware of bowel movement. But some people, they become paranoid about it. Then they try to take what we call laxative. Laxative, whether herbal or even chemical laxative, liquid paraffin they give, or there are herbal laxatives like Triphala Churn and Gandharvari Taki and all. These laxatives go on irritating. The intestines do get irritated, and once you withdraw the laxative, there will be rebound effect. So it can be habit forming. So best way is cultivate the habit, healthy bowel habit in your body without being paranoid about it. At the same time, you can facilitate it by consuming little more cellulose containing vegetables and fruits like our guava. We call it amrut in Hindi. It's a fruit which is the best for this. Plus, it has vitamin C, then the seeds have iodine in it.
But a lot of fiber.
Lot of fiber. It's more than even apple. And this also facilitates in clearing bowels. So one should refrain from straining. Then one should not be paranoid about it. But at the same time, you have to drink little more water because even dehydration can cause hard stool and which finds it difficult to negotiate through anal ring. So sometimes too hard stool, then anus has to dilate. While dilating, if there is a dryness and crack goes and then the anal fissure. So these are the complications of it. So if we keep a healthy bowel habit by drinking enough water, have cellulose containing vegetables, and then cultivate the habit of passing stools without straining. So these things will help us.
Wonderful. Thank you.